The main focus of the debate on smoking in cars yesterday was around the levels of toxic chemicals released into the environment in the car when someone smokes there. And in particular, levels of particulates, which are 27 times higher in a car than in a home, or 20 times higher than in an environment such as a pub. And the exposure of children to those toxic chemicals in particular came up in the debate.
Because not only is it the adults who are consenting who are involved in the smoking, but there has been some research done which shows how those children are affected, hasn't it?
Yes, there's a British Lung Foundation survey which shows that 86% of children were concerned about adults smoking in cars, and worryingly 1 in 4 children felt they were too afraid to ask an adult to stop smoking in a car in which they were a passenger.
So perhaps not surprisingly with those statistics, the members passed a motion for the BMA to lobby for a ban on smoking in cars. In years past, that would have been unthinkable. Do you think now it's quite hopeful that that will happen?
I think the passing of the motion does represent another step along the path of making smoking unacceptable. And the key thing about seeking this legislation is not to criminalise smokers in cars, but it's to establish a cultural norm that smoking in cars is unacceptable.
But how would it possibly be policed?
Well, as I say, I think it would be difficult to police, but I use the analogy of speed limits, which are difficult to police and sometimes are ignored, but they do set a norm, and most drivers drive around the speed limit. So what we're saying is it's a bad thing to smoke in cars. We don't like you to smoke in cars. It causes health disbenefits to passengers, and so please don't.
And what difference would it make to your patients as a public health doctor?
I think it's about re-emphasising that although we're getting on top of the fight to reduce tobacco-related harm in society, it's not won yet, and so it's another tool in our armamentarium to tackle tobacco-related harm.
And what evidence do you see in practice of people being affected by it?
Well, it's related to things like asthma rates in childhood, and of course there is the risk in extreme cases that children exposed to consistent smoking in cars can become addicted themselves and could become smokers, and that's something obviously we want to avoid.
So will the Public Health Committee now go on to lobby?
We'll go on to lobby as an association, so it will involve the Public Health Committee and also the Board of Science, who will pick up this motion and seek to act on it.